Get started. So welcome to the webinar, Fear of Recurrence for Breast and Ovarian Cancer Survivors with Dr. Wendy Lichtenthal. My name is Christine Benjamin, and I'm the Breast Cancer Program Director at SHARE. So before the presentation begins, I'd like to tell you just a little bit about SHARE. SHARE is a 40-year-old nonprofit organization that helps people through breast or ovarian cancer, offering the support of those who've been there. SHARE offers many services, including breast and ovarian helplines, telephone and in-person support groups, and educational programming. All services are free of charge to participants. For more information, you can visit our website at sharecancersupport.org. This presentation will be recorded and available on the SHARE website soon. All participants will be muted during the presentation. You're welcome to submit questions throughout the presentation. And to do that, you must locate the question pane on your webinar control panel on your screen. Type in a question there, and when the presenter finishes speaking, questions that have been submitted will be read. So now I'd like to introduce our speaker. Wendy Lichtenthal, Ph.D., is a licensed clinical psychologist and director of the Bereavement Clinic at Memorial Sloan Kettering Cancer Center's Counseling Center. Dr. Lichtenthal specializes in helping patients with cancer and their families with a focus on supporting breast cancer patients and assisting individuals coping with losses, fears, and life changes. She uses a variety of psychotherapeutic approaches with an emphasis on cognitive, behavioral, and existential therapies, helping individuals to find meaning in and after challenging life events like a cancer diagnosis and completion of treatment. I'd like to introduce Dr. Wendy Lichtenthal. Thank you so much for being here.
My pleasure. Thank you so much for having me, and welcome to everyone online. As Christine mentioned, I'm going to be focusing today on fear of recurrence. And what I hope to do by the end of today's webinar is help each of you find for yourselves something, creating something of a fear management toolbox. So hopefully we'll be able to go through different ideas and approaches, and some of these might be helpful for you. To start off with, I just want to center us a bit and think about why you decided to log on today. What brings you here today? And I think the answer for most everyone is because this is hard. Managing fears after a cancer diagnosis can be really, really challenging. And I think we want to start by just acknowledging that. And that's a thread that's going to continue throughout today's discussion, both in my presentation and I imagine in your questions as well. We want to acknowledge first and foremost that having a fear after a legitimate threat is a really challenging thing to manage because it's normal, it's appropriate. So what we're going to be talking about today, and what I hope to do today, just to give you a little overview of the webinar, is first say a bit about the research and what the research tells us about fear of recurrence in cancer survivors. I'm going to then share with you a little bit about our group's efforts and research to develop an intervention to help with women facing fear of recurrence. And then finally, and hopefully for the bulk of the presentation, be speaking with you about some ideas and different approaches to help you think about what you can do to manage your own fears and create, as I said before, kind of a fear management toolbox. So let's start off with a little bit about what we know from the literature about fear of recurrence. What the literature tells us is that really this is a cancer survivor's most common concern. It's extremely common for cancer survivors to think about and worry about their disease recurring after completing treatment. And depending on what group you're surveying, rates of fear of recurrence have ranged from 26% to as high as 99%. The other thing that we know about fear of recurrence is that it really persists. So even 5 years post-diagnosis, up to 3/4 of survivors are still really worrying about their disease recurring. So it's prevalent and persistent. The other thing that we know from the research and from, of course, our experience with one another is that what a given person fears differs. So it varies from one person to another. The common denominator is that the disease will recur, but the actual content of the fear varies. So some individuals may be worried about having treatment again in the future, so chemotherapy or surgery or radiation. Some individuals worry about hospitalization. physical changes, of course, loss of hair, the emotional distress, thinking about what they went through in their initial diagnosis and not wanting to go through that again, fears of pain, fears of disease progression, fears of the family members or loved ones suffering, and of course, fears about death. The other thing that we know is that higher levels of fear of recurrence can really be preoccupying and impairing. They can really get in the way for someone. And so studies have shown that fear of recurrence is associated with depression and reduced quality of life when it gets high enough. It's also associated with increased body monitoring, and this may ring true for a number of you on the call today, that the more anxious you are, the more you end up checking your body and monitoring your body, trying to understand and interpret different pains and sensations that you feel. It's also associated with being more anxious before you have medical visits and an overall kind of general preoccupation with one's health. And for professionals like myself and other mental health providers, someone who comes in saying that they're anxious that their diseases recur, it can be really challenging to manage, even for professionals. So one study showed that in a survey of psychosocial professionals, over 90% found that managing fears of recurrence was at least somewhat challenging to do. The beliefs that an individual comes in with are largely not irrational. So to tell someone, hey, just don't think about it, doesn't usually fly. So it really is challenging for all parties involved. And professionals, therefore, often are interested in kind of what can I do? So in this survey, close to 100% of those surveyed said they wanted more training in how to help survivors cope with their fear of recurrence. But despite this, there haven't been a whole lot of efforts to develop interventions that really target fear of recurrence. It's increasing more and more, but traditionally this was not getting a lot of attention. And so one survey conducted found that really managing one's fear of recurrence was the #1 unmet need of cancer survivors. So there's been this compelling need to develop interventions that really do target fear of cancer recurrence, and that has led our group to do some work in this area. And so like I said, I'm just going to briefly go over some work we've been doing and then bring it back to kind of more hands-on practical things you all can do to help manage any fears you may experience. So as I mentioned before and started today's discussion, fear is normal and appropriate. When you're threatened with something, anything that's threatening, we become anxious and we attend toward it. So I'm going to be talking to you for a bit because the focus of our work is on what we call cognitive biases. Now, cognitive biases, what that refers to is just the way you tend to think about something. So having a tendency to be attending in your surroundings towards certain types of things. So for example, after a cancer diagnosis, some of you may have noticed when you hear the word cancer, your attention kind of runs toward it or perhaps away from it, but there is a tendency often to respond when you're in a kind of a threatening situation to be looking out for that thing that you're afraid of. And that brings us to what I was saying before about your body even. So when you have a certain kind of pain, you may interpret it and wonder, what does that mean? What is the meaning of this pain? What is the meaning of this sensation or of this itch? So attending to things in our surroundings, in our bodies, in a situation where it's been threatening is normal and adaptive because you sometimes need to bring attention to that. And similarly, interpreting things as threatening or dangerous can be adaptive when there actually is threat or danger. But what happens when the danger has dissipated, when it's gone away, is that sometimes one's anxiety can be maintained by these biases staying in place. So maybe in the beginning, it's really important to be attending to your body and understanding as you're going through treatment so you can report side effects. But when you've completed treatment, to be kind of having that same attention and monitoring to the extent that you were can sometimes get in the way, as many of you probably know. But that bias stays in place, the bias to attend to your body, to attend to the environment, the bias to interpret things that might be unclear as potentially dangerous and threatening, that bias can stay in place. That kind of way of thinking can stay in place, but that can maintain your anxiety. And then there's a vicious cycle because these biases make an individual more anxious, and in turn, when you're in that heightened state of anxiety, you tend to process the world around you as more dangerous, which makes you more anxious. So it becomes, again, this vicious cycle. And when you're in that state of kind of tending to the environment in this way and interpreting unclear situations as potentially threatening or dangerous, it's really hard to just talk yourself out of that and say, well, let me just not think about it that way, because you're in a heightened state. So the program that we've been working on is what we call cognitive bias modification. And it's a computerized approach. It's been used in a lot of different conditions with a lot of different types of anxiety. But what we've been working on is adapting it for fear of recurrence. And it's a program that involves these computerized tasks that help kind of retrain the way you attend to different kinds of stimuli, different things in your environment. And you retrain your mind the way you're thinking to develop new habits, new ways of thinking. And it's done with these computer tasks really rapidly, really quickly, with a lot of repetition in a way that ends up being kind of outside of your conscious awareness. So that's sometimes easier to work at that level than just telling someone, hey, think about this differently. And so this computer program that we've been evaluating, it can be done at home. It's cost-effective. You don't need a therapist. There's no medication involved, and it takes very little time, relatively. So we've been trying to evaluate it in a pilot study to see if this can help, and we've been focusing with breast cancer survivors as a start. We've been looking at this to see whether doing this kind of retraining on the computer is helpful at all. The other thing about it that's great is that we try to personalize it with the things that a given individual is most concerned about. So it's not just a blanket intervention. We take words that are and kind of situations and scenarios that are personally provocative. So, for example, one of the tasks involves pairing a word with a sentence, and the sentence would be something that's unclear, like the nurse left a voicemail. And so we present an interpretation of that as recurrence or bad news, or you get the word appointment reminder. And so the idea would be that we try to help individuals retrain their way of thinking when something is unclear, to think about and consider an alternative scenario, not just the kind of worst case scenario. And again, it's done through these computer tasks, and which is, we think, kind of working at a different level of awareness. So this is what we've been testing in our group. And what we found in a recent study that we completed is that women who completed these self-report measures before and after doing the program went from having close to a lot of fear on average to kind of low, moderate levels of fear. So if you look at the lines on the computer, and I don't know if my cursor shows up here, but if this is our control group, so this was a group that got a placebo computer program that really didn't have anything that it was trying to actively achieve, and this is the group that got the program, this computer program that I just mentioned, their anxiety decreased. So compared relative to the computer after the intervention, and then 3 months later, which was our follow-up period, we see that anxiety decreased even more, whereas in this control group it stayed the same. So again, this is a pilot study. It was somewhat small. We had by this point 78 women who participated, and in here 75 women. But it is suggesting some promise and something that we're going to continue following up with. We saw that it improved these health worries, but like I said, it was limited because it was a small study. The computer program we had was a little clunky, and because in this study, women did complete the sessions at home, we can't be sure how much they were, if the phone rang or there was any distraction, so we didn't have a lot of control over the situation. So it's hard to know, what happened for a given individual. But our plan is to take this forward and see if we can make a less clunky computer program, probably through an app to make it easier to use and more transportable, and adapt it for other cancer survivor populations, because as I mentioned, for this study, to keep it small, we just started with breast cancer survivors. Okay, so having said that and given you a little bit of background about, as I said, the literature on fear of recurrence, which, I don't think anyone on this call needs convincing that this is a common concern and highly prevalent and persistent. And having told you a little bit about our efforts to try to help address it, I want to tell you more about what you might be able to do now to manage your own fear. So first, I'm going to just let you know that there are other groups and individuals who have been trying to look at different approaches for managing fear. So just to give you this background, and so one thing you can do is try to stay abreast of the literature, try to keep up and see what has been done, so that if you ever do go to look for support from a professional, you can ask them, about these different types of approaches. So one approach that's been examined is called metacognitive therapy and acceptance and commitment therapy. Another acceptance and commitment therapy trial is going on right now. There's another trial that's looking at cognitive behavioral therapy. Mindfulness-based stress reduction has been looked at, and most recently published is a trial looking at writing letters expressing one's gratitude to people in one's life, and that actually showed some benefit in terms of fear of recurrence as well. So these are just some things to keep in mind and to talk about if you do speak with any professional or if you examine the literature yourself. But that's what we want to talk about today, is really focusing on what you could do for yourself, what pieces of these studies might be helpful for you. And so I want to talk about creating your own fear management toolbox. So what I'm going to go over today as an overview is about how you can normalize and validate your fears. We're going to discuss sharing and processing them, making sense of the many responses you might have to your own anxiety. We'll talk a bit about establishing effective ways to communicate with your healthcare team. We'll talk about cognitive behavioral techniques, which, as I mentioned, have already been researched in this area. We'll talk about mindfulness strategies, which has also gotten attention in this area. We'll talk about how to redirect your attention in gentle ways to keep you in the present moment as much as possible, and the strategy of focusing on finding meaning in your life. And the thread across all of this that I will keep emphasizing is maintaining compassion for yourself, for your fear, for your reactions, because that is really key to managing the anxiety that emerges for each of you. So there's also a little emphasis there that's really going to be important here. So after you've started with this stance of compassion toward yourself, let's talk about normalizing and validating. I started out today by saying this is hard. Having anxiety about something that's been threatening to you is natural and normal. So you want to first give yourself permission to feel. When we get in a fight with ourselves, when we get in a fight with our emotional states, that's often when we get a little more stuck and run into trouble. So I'm going to say this in many ways as I go through these different strategies, but I cannot emphasize enough how important it is to allow yourself to feel what you're feeling, to not be at war with yourself or think this is silly or it's too much or what's wrong with me, or those very common self-critical thoughts that many of us have, but rather to give yourself that permission to feel. And once you've been feeling, and when you're experiencing these things, using self-talk is a perfectly good and sometimes very powerful strategy to say, of course I feel this way. Of course I'm scared. Of course, when I just heard about that story about someone I know that got me anxious. Of course, when I just saw that commercial on TV, about a cancer center, my heart did a flutter there. So giving yourself that kind of self-talk, that nurturing presence for yourself and validating your feelings can be so important. And if it's harder to do it for yourself, or even just as reinforcement, check in with a friend or a trusted family member, or of course other survivors, and that's what SHARE is all about, to get that normalizing, to get that validation for what you feel. I want to say here, don't underestimate the power of sharing. When we are anxious, our minds can go. Everyone on the call knows this. Your minds can race. And when it's all up there kind of fluttering about, thoughts are shooting off left and right, it can feel really overwhelming. And often what we find, and this is why, people go to therapy, in fact, is that there's a lot of power in sharing, in getting it out, that kind of catharsis. So getting it out from all the muddy thoughts and scary thoughts in your head and just letting that steam out of the kettle can be, in and of itself, a very powerful intervention. And as the feelings come up, as I mentioned before, having a compassionate stance means making sense of your responses. So we all bring our own context to a given situation. And with a cancer diagnosis and with fear of recurrence, you come to the table with some background, with some history. So whether it's because you know someone who's had recurrence, there's a family history that is part of your background, whether it's because you yourself have had recurrence, you're bringing your own context. You're bringing your own worldviews. You're bringing your own history. And so whatever it is that you're thinking and feeling, I can guarantee you makes sense. It always makes sense. The story always makes sense. So we want to just think about, why are you feeling this way? Well, there's going to be a good answer. And if no other answer, it's because of the history you had. For everyone on the call who's had a cancer diagnosis, you've been in a threatening situation. So understanding, being compassionate to your feelings and making sense of those responses is very important. What is your background? What are you bringing to this? Whether it's your current experiences or past relationships, all of it is going to impact how you feel today. It's also important to express your emotion in helpful ways, to get those feelings out. So you can do this through discussing with other people who are supportive, as I mentioned before. And also writing can be very helpful, and journaling for some people. So if you feel like the thoughts you have are, for whatever reason, not thoughts you want to share with other people, then journaling can be a very powerful way to get those feelings out, to help get a little distance from those thoughts and feelings, put them on paper, observe them, and make sense of them. As I mentioned before, we each come to a situation with a given lens. So be compassionate toward the lens through which you view the world. You have a background, whether it's a background of loss, a background of cancer, a background of, I'm healthy, this stuff doesn't happen to me. You have a lens that you viewed the world with before the diagnosis that you experienced. And sometimes that lens can feel like it's fogged over. It could feel like the glass is shattered with a diagnosis. So just remember what you came to the diagnosis with, what you went through with treatment, and be compassionate toward that lens. Another important point, as we're talking about strategies, is also communicating with your healthcare team. So sometimes information can be very powerful. So something to just think about is, what information do you need to know to feel more comfortable? People vary on a continuum in terms of their need for information. Some people say, I don't want to know anything, I'm just going to do what I'm told, that's fine by me. And other people are what we psychologists call have a high need for information. They like to be informed. And then, people fall all in between on that continuum. So how much information do you need? What kind of information do you need to know? What would make you feel most comfortable working with your medical team? Do you want to know exactly when you should be contacting them about any symptoms you experience? What is your provider's recommendation about surveillance? And do you have any questions about that? Do you want to know why they make the recommendations that they do? When should you expect results after tests and scans? This is something, when I'm working with the women I work with, comes up all the time when they're waiting, expecting that they would have heard back from someone after a given test or scan, and they are waiting, thinking it's meaningful, that there's some sort of delay, even if it's hours. It depends on your expectations. So kind of getting that up front can save you a lot of worry and headache if you know what to expect. So try to get that information so that you can manage your expectations accordingly. When you do have concerns, what's the best way to reach your medical team, and who should you be reaching out to? A nurse, the doctor? This can also, sometimes people have talked to me about reaching out to their doctor. Their doctor's in clinic all day and not even able to check. They sent an email and they didn't get a response all day, and it's very, very anxiety provoking. So finding out, when I have a concern, who should I be reaching out to when it's more urgent, and how soon should I expect a response? Because again, what I talked about before when I was mentioning cognitive biases, when a situation is unclear and we are in an anxious state, our go-to position is most likely going to be a threatening interpretation. We're going to say, I'm not sure what's going on here, so maybe it's something dangerous. And so, again, trying to get information from your medical team to prevent those unclear situations as best as you can be an important first step. Finally, what strategies do you think you will need to get your needs met with your medical team? And kind of speaking with them openly about that sometimes can help to preempt any miscommunication. Okay, so now I want to move a little bit into what we call cognitive behavioral strategies. So some of you may have heard these terms before, cognitive behavioral. It's a type of approach, a type of therapeutic approach that a lot of individuals practice. And basically what it means is that it's referring to the fact that cognitive means thought and behavioral are the behaviors we engage in. And it's linking the fact that the way we feel about a situation affects how we think and what we do. The way we think about a situation affects how we feel and what we do. And what we do in a situation affects how we think and what we feel. So it's basically cognitive behavioral is referring to this relationship between how I think about a situation, how I feel about a situation, and what I do. And when an individual has anxiety about recurrence, a very common pattern is, of course, this thought, starting with the thought here, my cancer is going to recur, this anxiety-provoking thought, which then leads to, here, fear, feeling scared, feeling anxious. And then the behavior that one engages in when they're feeling anxious, sometimes these behaviors, they kind of give you relief in the short term, but they end up actually keeping that anxiety, maintaining that anxiety, as I mentioned before. So when an individual gets scared like that, it's very natural to kind of avoid trying not to think about it. Sometimes you might end up checking your body, so if you feel like you've had some strange sensation in your body, you might start trying to feel around in your breast or to feel around in your pelvic area. Or sometimes it might be in the form of reassurance seeking, so reaching out to someone you trust or to your medical team. So again, this is linking the relationship between what you think, what you feel, and what you do. And in considering your beliefs about anxiety, another thing that I just want to draw attention to is that not only do we have beliefs like my disease might recur, but you have beliefs about your beliefs. So people might be thinking, wait, I'm getting really nervous about this, but worrying about my cancer is going to make me sick. So they might get anxious about their anxious thoughts. Other people might think worrying about cancer the way I am, it's actually helpful to me. It's preparing me. I, in essence, want to keep this worry. So these kinds, we call these metacognitions, are basically beliefs about your beliefs. Those kinds of thoughts about your beliefs can really be powerful. So if you can imagine, if someone's saying, I want to keep my worry here because it's keeping me prepared, it's keeping me on top of things, that individual, their anxiety is going to be maintained because, in essence, even if it's not really conscious, like they're doing it on purpose, they really do hold that belief that it's important to stay on guard, to stay on top of things. And then other people might be worried that the anxiety that they feel is going to get them sick, which of course leads to what? More worry. So they become worried, they interpret their worry as something dangerous, and then they become worried that they're doing something harmful to themselves. So they feel badly about feeling badly, which is a very, very difficult situation to be in. There are also beliefs that people have about their relationship to their feelings and to their anxiety, like, I can't handle this, it's too much, it's overwhelming. So all of these things, in essence, can contribute to maintaining this fear of recurrence. And so we're going to think a little bit about that. So how do you respond to all of these thoughts that I was just mentioning? Thoughts at the most basic level that the disease can recur, thoughts about your thoughts that it's helpful to think this way or it's really dangerous to think this way. How do you address this kind of distress with helpful thoughts? So one thing is to reframe thoughts that are not helpful. So the thoughts about the dangers of worrying, things like that, getting information and keeping yourself thinking this is not a helpful thought. This is not a beneficial thought, rather than this is true or not true. We're not talking about accuracy here, but more about, is it a helpful way to think? Is it helping me to stay in the state of thinking that it's good for me to worry or that it's dangerous for me to worry? So reframing that is important. And coming up with some helpful responses, things that work for you. That, you know, this isn't helpful for me right now, or let me focus on something else. But in doing so, really attempting to minimize the critical self-evaluation. Remember, the message that I started out with and I've continued to emphasize today is about compassion, really being compassionate toward yourself. So as you feel whatever you're feeling, saying that's natural, that's understandable, and of course I feel this way, is such an important stance. The shoulds, I shouldn't feel this way, I'm only getting myself sick, or I should be thinking like this, I need to stay on top of things. Those kinds of beliefs about your beliefs, those shoulds, those rules, try to gently massage them out by being compassionate toward them. You understand where they come from, okay? So everything that you think, these beliefs about your beliefs, came from somewhere, whether you heard it from someone, whether you read it somewhere, whether it worked for you at one time to be really worried about something because in the end it seemed like that thing you were scared about didn't end up happening. So then you think, well, it was helpful to worry that time, so I'm just going to, worrying works for me. It keeps me on top of things. Everything that you feel and the way you think, like I said before, makes sense. Your story makes sense. But that doesn't mean that it's working well for you in this context. It doesn't mean it's working well for you in terms of helping you stay in the here and now. And so with that in mind, it might not be a helpful way of thinking. So it's not wrong, it's not stupid, it's not silly, it's not neurotic. It's just that it's not helpful right now. And one way to help us really think about a more helpful response, a more nurturing response, particularly for women, is to think about what we would tell a friend or a loved one. So if someone you know is in this situation, or perhaps someone you know who has been through cancer, and they said they were thinking in a certain way, what kind of compassionate response would you give them? And because, like I said before, when we're in our heads, when our minds are racing, it is really hard to access the most rational, kind thoughts. So one of the most powerful ways to get ourselves out of that is to just say, what would I tell, and fill in the blank for yourselves. Think right now of who that person might be that you would say, if it was a relative, a sister, a daughter, a mother, a friend, think of who that person is who maybe gets anxious here and there, and what you say to them. What are the compassionate responses you offer those people in your life? And try to access that and then apply it toward yourself. So that can be, I think, one of the most powerful things we can do to get ourselves a little distance from inside our heads. You can also change the meaning of the surges of anxiety because, as I said before, and if there's kind of one thing you take away from today, it's that these surges of anxiety after you've been through a threatening situation are expected. These waves are expected. And so you can't stop the waves. But the message here is that you can learn to surf them. We're not trying to stop anxiety. In fact, if you ever go to a mental health provider and they tell you they're going to get rid of your anxiety completely, that's a little concerning because we need a little bit of anxiety, first of all, because a little bit of anxiety helps us to do things that are important to us. A little bit of anxiety helps us to get ourselves to the doctors for routine screenings and things like that. So no one is trying to ever get rid of all of their anxiety. And then there are going to be things in your surroundings and situations or feelings in your body that are going to bring these waves, these surges. We can't stop that because it is understandable and appropriate. But you can surf these surges as they come up. You can view them as temporary, because they will be, manageable, that you can handle them, and natural. Temporary, manageable, and natural. The surges of anxiety you feel, they are not going to keep going and going and going. You can manage them and get on top of them with the types of responses we're talking about, with speaking about it, with getting those anxious thoughts from inside your head out. And they are natural, and so you can keep viewing them and appraising them and perceiving them as valid and understandable. Okay, so that's focusing on the way we think about the fear. Let's talk about what you can do, what kind of helpful behaviors you can engage in. So we think a lot about avoidance as kind of this paradoxical of behavior, because in the short term, when we avoid a situation that brings us distress, it really helps. It actually is effective. You get short-term relief. So if something's really anxiety-provoking for you and you say, I'm just not going to think, I just need to get away from that, I'm not going to think about it. In the short term, that's an effective strategy. The problem is that in the long term, the more we get away from situations that cause us anxiety, the more likely that anxiety is to be maintained. And that's for a few reasons. One of them is that you felt the relief when you avoided, so we call that negatively reinforcing. When we get relief from something, we want it again and again. It's like a reward to feel relief. So each time that a situation that's anxiety-provoking presents, you might find yourself saying, hey, it was easier to just avoid it last time, so I'm going to avoid it this time. In the short term, you feel relief, but in the long term, every time you encounter a situation like that or another situation that's also anxiety-provoking, you might find yourself more anxious about it, because we also kind of forget that we can handle distressing feelings. We need experience. Remember before I was saying things are temporary, manageable, and natural. To truly believe that you can handle your feelings of anxiety, you have to move through it. You have to live through it. It's not a therapist or a friend or anyone telling you you can handle it. You actually just have to handle it. So we can do all this self-talk, we can have all this talk from other people and all this support, but at the end of the day, one of the most powerful ways to understand that you can cope with anxiety and the surges of anxiety that you experience is to actually cope with and experience the anxiety, to sit with it, to be with it, and to see that you do survive it. So minimizing avoidance, including the thoughts that you have and allowing them just to be, is an important behavioral response. And then there are behaviors with your healthcare providers that might be helpful. So in a given situation, if you run into any tension with healthcare providers, think about what your goal is in the situation and what actions or communication approaches are most likely to help me achieve this goal. I put this in here because a lot of women I work with, or I should say some women I work with, have some concerns. They need some information from their healthcare providers or feel like they need to be doing something differently. And because of fearing of disappointing their healthcare providers or feeling angry at them or whatever it might be, they end up choosing behaviors sometimes that actually kind of move them in the direction opposite than what they wanted, in a direction that's opposite from getting more information or from getting them the support that they want. And so we want to always be thinking about, and this goes for all relationships, but certainly with your medical providers, what do I really want here right now, and what's the most likely, the best path to getting me what I need right now. And then another behavioral response to have is to balance the scale. Engage in pleasurable activities. So when you feel yourself more overwhelmed, what can you turn to? Can you keep a list of things that are feel-good activities, that are go-to activities when you're feeling kind of overwhelmed, to balance those scales? And then relaxation practices as well. Certainly, to be anxious and relax simultaneously is a very, very hard thing to do. So using tools like deep and calming breathing and progressive muscle relaxation, which I'll say a little bit more about in a moment, can be really helpful. I also want to talk about an extremely important strategy, which is called Mindfulness Strategies. Many of you may have heard of this already, maybe you're already even practicing, but for those of you who are less familiar with it, I just would like to do a brief introduction because it really is such a powerful way of coping with anxiety. So we define mindfulness as moment-to-moment, non-judgmental awareness. A word that helps us to understand what it is to be mindful of something is the word noticing. So noticing what's around you, noticing with your senses, with your sight, with your hearing, with touch, with smell, with taste. That's the way we notice things. And we try to keep things non-judgmental, meaning kind of just the facts. What are the facts about the situation rather than thinking it should be a different way? So why is this important when we're thinking about anxiety? Well, being moment to moment, if you stay in the moment, you use your five senses. When you're in the moment, you are in the present, you are in the here and now. And that is really the best antidote to anxiety about the future. The best way to cope with things that are uncertain in the future is to stay in control in the here and now. And so mindfulness helps you pay attention to the present moment, brings you there as non-reactively and open-heartedly as possible. So moment to moment to moment, and noticing whatever it is that you notice, the thoughts that go through your mind, the feelings you have in your body, whatever it may be. And of course, when you're doing this, your mind wanders and you feel lots of things in your body or lots of feelings. Certainly one of the most common ones that we hear is someone saying, I can't focus, I can't pay attention, my mind keeps going. So you notice that your mind has wandered, we say, okay? So noticing whatever it is that is the practice of being mindful of it. I am mindful that my mind has wandered. I am mindful that I am speaking to you all right now. I am mindful that I have a little cold that I'm getting over, so I'm mindful of the fact that I might need to blow my nose soon. But I am not, being non-judgmental to that is what's wrong with me? It's not saying what's wrong with me, why can't I focus? This is so hard. I should have blown my nose before. It's trying to remain non-judgmental as possible in the moment. And we focus on the meditation part of mindfulness meditation is focusing on something. The something can be your breath. It could be touching your forefinger to your thumb and feeling what it feels like to just move around your skin. It could be having a raisin in your mouth and just feeling all the little crevices in the raisin. Just practicing being in the here and now, using your senses. And the breath is one of the most common ways we practice mindfulness. And so one way to think about this is that you focus on something like your breath, like a raisin, like the feel of your skin. Your mind wanders because that's what minds do. That's natural. And when you notice that your mind has wandered from whatever it is that you were focusing on, you just start over. You try again. You gently bring it back. And when you do that, and here are just some resources on that, and these slides will be available, by the way. There are lots of meditation websites and apps. But when you do that, you end up kind of practicing that skill, and you also practice this idea of acceptance. Acceptance of what you're thinking, acceptance of the fact that after being in a threatening situation like having a cancer diagnosis and going through treatment, it is natural to feel fear. And accepting that and working toward accepting that is part of this. So maintaining that compassion towards your thoughts and allowing yourself to think whatever you're thinking, allowing your thoughts to just be and trying not to push them out. Mindfulness can help with that practice because its practice is just saying, of course my mind is wandering, but let me bring it back to the here and now. You're not pushing your thoughts away, you're just letting them be. And then you bring your attention back to the here and now, back to your breath, back to the raisin, back to anything that you've decided is the focus of your attention in that moment. And it's a fine line because remember before I said not to avoid, right? That avoidance can get us into trouble. So it's this fine line between allowing your feelings and thoughts and all of that to be while also redirecting your attention to the here and now. So I'm not suggesting that you avoid your thoughts and feelings, but rather just let them be there, have a compassionate stance towards them, and then move your attention back to, for example, whatever it is in the moment, like your breath. But the practice of this can help you really engage in life, engage in anything that's important to you. It really helps you to be flexible in your thinking so that if you are out to dinner with family or friends and you're enjoying yourself, and here you are in the moment totally enjoying yourself, and then you have this surge of anxiety saying, what if I lose this? What if my disease comes back? And this happy moment, I don't have a happy moment like this in the future. Okay, so you've had that thought, you've had that concern. The thought is there, the accompanying feelings are there. You let them be. You offer yourself a compassionate response. Of course I'm feeling that way. I was just enjoying myself, and it's natural that I would worry about losing something so meaningful and important to me. but let me bring it back to the moment. That's the flexibility muscle. And the idea with these practices is to allow yourself, if it takes 100,000 times of your mind wandering to these places and then bringing it back to the here and now, then 101,000 times you will do that. And it takes a lot of practice, but the more you do it, the more you can kind of ride that wave as it comes, surf it, and come back to the here and now, which is really the name of the game here. You can also do other things to bring you back to the present moment with your body. So there are things like progressive muscle relaxation, which is where you kind of systematically tense and then release different muscle groups in your body. So you tense your abdomen, you tense your arms, and you release it one by one. Massage can be very, sensory and here and now and bring you in the moment. Acupuncture and exercise. And then there's finding meaning in your life. So I spoke about before this flexibility of having your mind wander when you're, let's say, out to dinner with friends or family, and your mind's wandering to these scary scenarios. Well, finding meaning in your life and coming back to the meaning in your life in the here and now can be the thing that helps you get through those moments. It's the why. It's the why bother of getting through those moments. And so as I mentioned before, there's actually been a recent study that showed that that writing letters of gratitude seems to have some benefit for individuals, probably because of this idea of moving back to the moment and pursuing things that are really important to you in the here and now. You can make go-to lists to review during those moments of anxiety. And you can think about what are the activities and experiences that are most important to you. What can you engage in when your anxiety surges? That doesn't mean use it as a distraction or avoidance, but rather to go deeply into the very life that you want to be living. What are the values you hold most dear, and how can you connect with those values and be living your life according to those values? And then thinking about with this challenge of living with fear of recurrence, which is part of this survivorship picture, who do you want to be? How do you want to stand before this challenge? I say this because a lot of the ways that we think about getting through a cancer diagnosis and the struggles, many struggles that happen with survivorship, the many sequelae of having gone through cancer and its treatment, from side effects to anxiety to life changes and the stops and starts of life when your life has felt interrupted by the diagnosis. All of the challenges you face that may feel like they're well beyond your control, one of the principles that we talk about a lot with survivors is that in the face of these challenges, the attitude you choose is the thing you have control over. That, in these out-of-control situations, what kind of fear and uncertainty feeds upon, you can always choose your attitude in the face of these challenges. Meaning you can always choose how you think about it and how you respond to it. There's a quote in a paper on uncertainty that I thought was really powerful. It says, "Belief in a conditional world opens up the consideration of multiple possibilities since certainty is not absolute. A conditional world means the if-then. If this happens, then I will do this." So coming back to this idea, if everything's okay next year, then I will go back to school, quit my job, spend more time with my family, start writing that book I always wanted to. Those types of things, the ifs that a lot of cancer survivors live with, and that conditional world that you live within, can be stalling. It can get people stuck. So I want to just briefly, as we start to move towards wrapping up this portion of the webinar, I want to just talk about this idea of conditional living. How do you get unstuck from this pattern of thinking if and then, because you're living with this fear that something can happen in the future? How do you get unstuck and break through? So again, I'm going to keep saying this, but it's so important. Validate rather than criticize your feelings, because this experience is hard. Give yourself first a compassionate response before you do anything else. And then consider the choice you have in how you create meaning in your life and how you create meaning in the challenges you faced. Viktor Frankl has said, who wrote Man's Search for Meaning, everything can be taken from a man but one thing, the last of the human freedoms, to choose one's attitude in any given set of circumstances. So consider the responsibility that each of us has to live our lives, the ability to respond to the life you have been given. And think about the courage that it takes to move ahead and put one foot in front of the other each day in spite of uncertainty, which again is the fuel of fear. And think about your whys. He who has a why to live for can bear with almost any how. This is a quote by Nietzsche that Frankl references. He who has a why to live for, or she, I should say, who has a why to live for, reasons to live, can bear with almost any how, can live despite any circumstances, side effects, long-term side effects, anxiety, because there are reasons to put one foot in front of the other each day. And so I ask you to just think about, as we wrap up, what are your whys? If you're afraid of recurrence, and if at the kind of end of that fear is fear of dying and fear of not living the life that you want to be living, think about what you want that life to be looking like, and go deeply into it. And so in summary, if we're going to think about all of the different things that I've talked about today with fear management, again, one of the major takeaways is this idea of cultivating compassion toward yourself, understanding your personal context and lens that you bring to this fear of recurrence that you may have, being mindful of and compassionate towards your emotional responses, develop some sort of compassionate or helpful response or mantra, of course I'm scared, or let me go back to the moment, or simply the word compassion. Practice staying in the moment as much as possible, allowing the feelings and thoughts to naturally rise and fall, coming back to the moment, and living life meaningfully. Because as I said before, the antidote to worrying about the future is remaining in the present. So with that, I'm going to conclude and just open it up to questions. I will just put on this slide here, we do have a program for women who have a history of breast cancer. If anyone is interested, we are doing a study of different types of support groups, so just to put that out there if anyone has questions. But coming back to the content of the presentation, please let me know your thoughts, and we'll try to, in the remaining time, answer any questions. Thank you very much for your time and attention.
Thank you, Dr. Lichtenthal. That was a really excellent presentation. And I'm glad you talked a lot about compassion for yourself, because it's such an important topic, right? And people talk about it all the time, but it's so difficult in practice.
It is so difficult in practice, and it's what it takes, practice, 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 practice.
Right. And I think we can start doing that in little ways as well, right? So when you walk by the mirror, most women are like, oh, my hair looks terrible, or, oh, I put on a few pounds, and just making little adjustments right there and then can begin to create a pattern that is more compassionate for yourself.
Absolutely. And I think, as I said before, one of the best ways to get in that mindset is to just think what you would say to someone else, especially for women.
Right.
That's how because we're very good at giving it to others. It's just much harder to give toward ourselves. So if you're finding it hard to think of what you would, finding that compassionate voice toward yourself, just think of someone you love and what you would say to them.
Very true. So I just wanted to remind people to submit a question. There's a question pane on your control panel. You can type in a question right there. And in the meantime, I have a couple of questions here. So someone's asking, so fear recurrence is normal and expected. But at what point would you either recommend medication for someone if the fear just is continuous for a long period of time, and it's really getting in the way of the person's everyday functioning? So the question is, when might you recommend medication, and how do you feel about anti-anxiety medication?
Sure. Great question. So the thing about the topic of avoidance that I mentioned before, I mentioned that one of the problems with avoidance is that we, in essence, forget that we can handle a situation. We don't experience the situation. We get away from the feelings, and therefore the next time we have any feelings, we're like, uh-oh, I can't handle it. So the message, and I put up that one of the slides said, I can't handle this anxiety. So the message that I can't handle my anxiety is a very dangerous message to have, because it makes you feel like you won't be able to handle anything. You stay away from the anxiety-provoking situations, whether stay away meaning actually physically avoid it, or stay away from the feelings by doing things that are kind of either self-medicating or real medication to get away from the feelings. So my thought about that is that in many situations, what can be helpful is to practice slowly and gradually and kindly being with the feelings more, being in situations to kind of remind yourself, in essence, that you really can handle the distress. So that would be kind of my first line approach with someone, is to help them sit with difficult feelings and build up that muscle, that tolerance, so that they believe inside themselves, not because someone told them, but that they start to believe that they can handle it again. And again, it's not through words, it's through experience that we build that belief. Now, that being said, there are some situations where that's not practical, realistic, or the best for a given individual. So that's kind of my general belief about things, but there are situations where sometimes taking an anti-anxiety medication can really be helpful, particularly in an acute crisis, or if someone's not getting sleep and it's really interfering with their functioning, and it's having major consequences in their life and a ripple effect and kind of a downward spiral in their life. Taking medication to help get out of that, and then working towards building up a practice of tolerating these difficult feelings would be a direction I might go in. The thing that there are different types of medications, and I'm not a medication prescriber, so I won't say too much about this beyond the anti-anxiety medications that are called benzodiazepines are ones that kind of bring that short-term relief differently than antidepressants. So those ones that kind of bring that short-term relief are the ones that sometimes people then feel a little more like, I need to take this in order to cope, and that is the type of medication that can reinforce that belief that I was talking about. So for that, I would want that person to work really closely, ideally, work closely with either the person prescribing or another provider to help with making sure they still are building up their capacity to feel like they can handle things. So that would be kind of my caveat with using, and again, there are certain situations where you need to feel better in a certain situation, or it's just a scan that's coming up and they're not doing long-term therapy to work on this. They just want to get through the scan. So long answer, but a very good and important question.
That makes a lot of sense. Thank you. And then our time's just about up, so just one other quick question someone had. The cognitive bias modification program, is that available for people to use? I know that you said you may be inventing an app around it. But
right. So great question. So the answer is, for our work, no. We just finished a trial, and now we're going to try to do a bigger study of it. My email is there, so someone can feel free to email me to kind of check in on the status of things, and if they are interested in kind of our future work in this area, to certainly be in touch. And I'm happy to keep people current on our work in that area, and thank you for your interest in it.
Well, thank you, Dr. Lichtenthal, for a really informative program, and thank you all for participating today. We hope that you take a moment to fill out the survey at the end of the webinar. And Dr. Lichtenthal's information is right here if you'd like to contact her. And if you want to scroll back 2 minutes to show the study.
Sure. Oh, yes.
Give people
Sure. If anyone is interested in our study, they can email AIMstudy, AIM study at mskcc.org. This study will be wrapping up actually pretty soon. So if anyone is interested, it would be, you think you might be interested, and even the next couple weeks, it would be great if we hear from people. We're going to be closing this one down soon.
Well, great. Thank you so much. We really appreciate your time.
Thank you, everyone. And sorry I went a little over. If people do have questions, do feel free to contact me.
Oh, great. That's so kind of you. Thank you.
Sure.
Bye, everyone. Thank you.